Good morning, everybody. It's Dr. Galvin with another post-night shift ER update. I've worked a couple nights this weekend and wanted to give everyone an update about what's it looking like in the emergency department with Omicron and case numbers exploding and everything else. My name is, Jeffrey Galvin. I'm a board-certified emergency medicine doctor. I also run a functional medicine clinic in Charlotte, North Carolina. Been posting these videos since the beginning of COVID. If you find them helpful, please, like us on Facebook and follow us on Facebook and YouTube and hit the little subscribe button. So what's going on? Are we getting swamped with COVID patients? Definitely we are. We're seeing a lot of COVID in immunized people, but it's a very interesting contrast. 100% of the immunized people I personally have seen and my partners have seen over the last week or so have been very mild. Cold symptoms, the typical symptoms we're seeing in immunized people: sore throat, nasal congestion, maybe a little bit of malaise, not a lot of cough, some cough, and also some GI symptoms, mainly sort of diarrhea and nausea. The contrast is those folks who are not immunized, and the people who have not been immunized and have not had COVID before, a lot of them are getting admitted. And I admitted a 24-year-old with severe COVID pneumonia tonight and a 32-year-old yesterday, both fully unimmunized, both with really pretty severe COVID. So what we're seeing is much fewer admissions. I think the latest numbers I've seen, it sounds like it's about half as virulent, meaning that where we were admitting maybe 10% of people before, now we're admitting about 5%. But, we have a lot more cases so we have 600,000 to 800,000 or even 1 million cases a day. If we end up admitting 5% of those, then the hospitals quickly become overwhelmed. Now, the good news is that really the number of people who are really at risk are those who are unimmunized and have not been infected before. And estimates are that in the US right now, that number probably is closer to 15 to 20 million people. So a year ago, we were dealing with 330 million people. Now we're dealing with a much smaller subset. But I can tell you absolutely the ones who are sick are unimmunized. There's just I haven't seen a single immunized person who's been significantly sick. That doesn't mean they're not sick at all, but the vaccines do a very, very good job of preventing you from developing severe illness and dying. And infection with COVID probably does the same thing. The best situation probably for anybody is to be vaccinated and get a subsequent mild infection. Then you get kind of both natural and vaccine immunity, or the opposite. You have had COVID already and get a booster shot of a vaccine. There are good studies that show that you probably end up being super immune and hopefully very protected against all future variants. I've got to keep this quick today because I've got to get out of the ER as soon as possible this morning because we have a flood in my basement and I need to go deal with that. Did want to talk a little bit about kids. You're seeing in the paper, we're admitting a lot of kids. We are more so than we have in the past. Now, the symptoms we're seeing in children are sort of flu-like symptoms: upper respiratory cough, nasal congestion, fevers, croupy coughs, some GI symptoms, and some of those kids are requiring hospitalization. Now, just to give you an idea, this is the time of year that we typically see flu and RSV. Every year, RSV kills between about 100 and 500 kids in the US. Flu kills between about 100 and 150 kids. So far, in 2 years, there have been between about 650 and 800 kids who have died of COVID. Now, we don't have that data really broken out about who those kids are, but if you look at other countries that are seeing similar numbers, most of those children have some sort of underlying medical problem. So those are not, 600 or 800 healthy kids. I would imagine the majority of those kids have become some kind of chronic illness, from mild to moderate to severe chronic illness. So if you have a healthy child and they get COVID, their risk of either ending up in the hospital or being very, very sick is extremely low. If your child has a severe underlying medical problem, then you've got to keep a high level of suspicion and get them to the doctor or the hospital if you have any concerns at all. But for the vast majority of parents that have young kids that are healthy, I don't want you to worry. They're at low risk from dying or having severe disease from COVID. I'm going to cut it off there. I am going to talk more about kids and vaccines and other things later on in the week. I'm going to cut it short today. Everybody, please stay safe. Listen, there's a lot of COVID out there right now. Be smart. Get vaccinated if you're not vaccinated. Stay out of crowds. Wear a good N95 or KN95 if you have to be around a lot of people. If you're sick, stay home. If you've got to be around other people, please wear a mask to protect those other people. Stay safe, be smart, and I will talk to you soon.